Well, hello and welcome to the Radiology Gym. Don't forget, your brain is a muscle. If you don't use it, you'll lose it. So let's go to the gym, start working out. I'm Dr. Ahmed Abdul Wahab and I'll be your coach for today. Stay with me. Hi dear,
Hello, sir.
how can I help you?
Well, I'm a young radiologist and I was thinking of starting some training sessions with you, but I want to tell you that I'm still at the beginning. So if you please be simple and easy with me.
Well, yeah, sure, no problem. We can start from any level and work our way from there. So let's start with this MRI image of a 28-year-old male patient who was practicing sport himself while he suffered from acute pain in his left thigh. So MRI was requested for evaluation for the cause of this pain.
Okay, sir. Since it's a young male patient who suffered an acute pain during sport, so we are probably looking for some sort of injury.
Nice, good approach. So start.
Okay, so these are sagittal T2 weighted fat saturated images of the left thigh of this patient. And here, I don't know, but probably there is some sort of edema or something here. Or it can be just an artifact from bad saturation.
So what do you want to do?
I will look at other sequences. Let's go for coronal, for example.
Okay, these are the coronal images.
Oh, here I think it's obvious there is an area of edema involving this muscle, this part of the muscles of the thigh. And of course, he's an athletic person. We can see the big muscles of the thigh here and there.
Well, that's a nice catch. So which muscle is that and how severe is the abnormality?
Well, I want to look at some axial images first. So these are the axial images of the left thigh of this patient, showing that this muscle here is obviously edematous, indicating its injury.
So what kind of injury?
Well, since the muscle is intact, it's still continuous, there is no signs of complete rupture or retraction of the muscle, so probably it's just a partial muscle laceration. Whether there is any bleeding or not within the muscle, I think we will need T1 weighted images for this confirmation.
Yeah, sure, why not?
So these are the T1 weighted sagittal images of the patient, and I don't really see any increased, probably minimal increased T1 signal intensity here, indicating some minimal interstitial bleeding in this case. However, the muscle itself is still intact and continuous.
So you didn't tell me yet. Which muscle is that? This is basic anatomy.
I think this is the adductor longus muscle, and in coronal images, we can confirm that. Let's see. Yeah, this would be the adductor magnus, and this is the adductor longus.
Good job. Excellent, excellent. Good job. I like it.
Can we see in the axial images the adductor longus muscle?
Yeah, sure.
These are the axial images, and here we can see the adductor magnus and adductor longus here, and this is the adductor brevis. So this is just a partial tear of the adductor longus muscle with minimal interstitial bleeding, nothing else.
I wanted to ask you something for you to comment on. What about this thing here? Could this be some sort of collection or hematoma in the interstitial hematoma or the facial planes collection?
Well, I don't think so, sir, because these are T1 weighted images, and for it to be of any fluid consistency, it would be dark. However, if we compare it with the fat saturated images, like for example, here, we can see that this area has lost its signal intensity, indicating it's just fat between the different facial planes.
Wow, you're good. I thought to probably trick you, but you didn't fall for it.
Thank you, sir.
Good job. Keep going to the gym. Keep practicing. You'll be even better and better.
Thank you, sir. I'm happy to hear that.
Okay, see you later. Bye. So this was our exercise for today. Don't forget, like, subscribe, share, and tell your friends about us. If you want any private training sessions, send a message to the email in the description box. We will arrange something. See you later. Bye.